You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthrough in the treatment of gum disease. According to my first guest, no more bleeding gums, bad breath, or loose teeth. With us, we have an expert on the topic. He is Colorado's periodontist, Dr. Mathys. Dr. Mathys, welcome to the program.
Thank you very much. It's a pleasure to be here.
So for people that don't know your practice, who's your typical patient and what are the different procedures that you do and services you offer?
We see younger patients that have missing teeth. They could be missing because they've never had them, or after orthodontics, situations like that. Could be trauma as well. Those patients are often treated with dental implants to replace one or a couple of missing teeth.
All right.
We treat patients that are a little bit older and that are missing teeth as a result of decay, or they've had various other dental problems that happened. And those people are treated with dental implants to replace multiple teeth in many situations. As patients get older, they sometimes lose or need to lose the teeth in one arch or in both arches. They can be edentulous, meaning they have no teeth left. And there are great solutions for those people. We treat those with dental implants that support either removable dentures. Those are teeth that can be clicked.
Like a snap in, snap out kind of a thing?
Snap in, snap out is a great way to put it.
Okay.
Also, we have solutions where patients get a couple of more implants, and then you can have a solution that actually the patient cannot remove. So it's almost like their own teeth. And that is a great way to go for a lot of people.
Like a fixed set of teeth that don't come in and out.
That's exactly right. Now,
supported by dental implants.
Correct.
Okay.
That's exactly right. For people who have, and this is an entirely different type of topic, they have receding gums, and it can be unsightly, it can be unpleasant, it can be painful, it can be cold sensitivity.
Kind of a thing?
Exactly.
Yeah, what do you do for that?
We can treat those people with gum grafts, and gum grafts are a very predictable way to treat patients like that, and it's a very natural looking outcome at the end of the procedure.
So as a periodontist, I mean, your specialty is what? The gums,
and supporting jawbone.
Okay.
Those are basically, that's our playground, if you will. Another part of our practice that I'm here to talk about is perioscopy. It's really nice to be able to treat the most common disease that affects people, which is periodontal disease, in a manner that is predictable and non-surgical, non-invasive. As you know, a lot of medicine and a lot of dentistry these days is focused on minimal invasiveness. And it's very, very nice to be able to treat people in a way that is comfortable to them and doesn't leave them with unpleasant side effects of procedures.
And jumping right into it, because we've talked a lot about this, and I've tried to wrap my mind around it, but when you go and get a deep cleaning at a dentist with the hygienist,
right.
They go in and by feel, they kind of clean and scrape the area, right?
That's right.
Now, I don't want to put words in your mouth, but you say that that's a bit of a blind procedure.
Right.
You do it under scope where your hygienist is looking at a monitor,
right,
and it's being done more effectively.
Right.
Is that right?
That's exactly right. Perioscopy allows us to make a procedure that used to be the old-fashioned deep cleaning. You may have heard that term before.
Yeah.
Deep cleaning is often done by hygienists, and before this type of technique, perioscopy, becoming available, you could only do it blind. And that means the hygienist is going by feel only. And this is a little bit like if you're having to repair something behind your dishwasher and you're trying to put a nut on a bolt and you can't see it because it's behind your dishwasher, that is a lot harder to do than if you can see it right in front of you. Perioscopy has taken this procedure that used to be blind and turned it into something that is now visible. It's very different than a normal deep cleaning because the hygienist, instead of bending over and looking in your mouth to see what's going on, she is now able to look at a monitor, and the monitor shows the image that is produced by a camera that is a teeny little camera that is inserted between the gum and the tooth, and it allows the hygienist to see every aspect of the tooth below the gum line. That used to be blind, and now it's become visible.
So this bacteria, or tartar, lives underneath the gum line onto the root surface of the tooth, right?
Right.
So there's two ways to do it. I guess a few ways to do it.
Right.
To go in there and kind of scrape it,
right,
or to actually go in there and look on a monitor and get all of it.
That's right. That's
Is that
right.
right?
That's
and you're
right.
like the only guy doing it out. And I'm not trying to side with you. People need to know this. But you're probably the only, that you said that you know of, you're the only guy in Denver doing it this way.
There's a long learning curve to it. It is a great benefit to the patient, but it's not easy to do. You can't just simply go out, buy the tool, and expect it to work on its own the next day.
It's like a $25,000 microscope kind of a thing.
Exactly. And if you don't use it, it can be a very expensive coat hanger. So you want to use it, but that means there's a lot of training involved, and a lot of training, a long learning curve. There's just a lot of skill involved. It's an art and a science at the same time.
Now, your hygienist does it also in your practice?
She does, and she has the right personality for it, because you have to have good hands. You also have to have patience, because it really does take patience to learn this. And once you know it, you can never go back to the old way. Because once you can see something, you can see what you're doing, you never want to go back to a time where you were blindly feeling your way around and you could never see what you were actually doing. When you don't see what you're doing, you're essentially trying to scrape bacterial deposits off the roots below the gum line. You can't see it. You're going to leave a lot behind. And it's really quite a playground for bacteria underneath the gum line. You may not really think about it in your daily life, but there is just a lot of playground for bacteria to grow and cause damage to your gums. That's why so many people have gum disease. But when you can actually make this visible, what happens is you're able to remove the cause of periodontal disease and bleeding gums, gingivitis, while you're doing it. So it's not just a vision before and after, it's also visibility during the procedure. So you're really seeing what you're doing while you're doing it. And that is a tremendous benefit that we've just never had before.
So even the best hygienist in the world, right, whoever she is or he is, right, if they're not using a periscope, is that what it's called?
That's correct.
Then they're just blindly doing the best they can to get rid of this stuff that's causing the bleeding gums, bad breath, and all the other stuff.
That's right. And
you think that's old school? I don't want to put words in your mouth, but is it?
I think it really is.
Okay. How many procedures are being done the old way in Colorado? Like every day, like 10 procedures?
I would be guessing there are
procedures?
thousands, I'm guessing.
Really?
Yeah. It's a very common procedure. It's probably one of the most common procedures that are done in dental practices.
So if you're going to get a deep cleaning, get it done this way.
Absolutely. You do not want to have to do a deep cleaning under blind conditions, because you're going to have to come back over and over, because the bacteria that were left behind the first time are going to still be there for the second time and the third time.
So they multiply and multiply and keep coming back.
Bacteria do that, and especially when they have a wonderful environment to grow, such as the space below our gum line.
You're a periodontist, right? So by the time they get to you, they're in trouble.
Oftentimes, yes.
The general dentist sent them over you. They don't want to see you. People don't like going to the dentist, right? Do they say that to you?
I have heard that once in a while.
Like once in a while, or every day?
Like pretty much every day, a couple of times a day before lunch and a couple of times after lunch. And of course, there's a lot of reasons for it, because patients often experience dental treatment as not particularly pleasant. It's an invasion of their personal space. It may not always be comfortable. So if you can do a procedure that you only have to do once instead of multiple times, they tend to like the dentist a lot more after that. When you do a deep cleaning procedure and it's blind, there's a lot of bacteria left behind, even in the hands of the best hygienist in the world. It's just unavoidable. It's part of the procedure. You're going to naturally have to come back a number of times over and over to get the bacteria that were left behind the first time that have now grown, and there's more of them. So you have to go and get those later on. And that happens over and over again.
So it saves money by doing it this way, with a periscope.
That's right. Because you only have to go one time, very typically only one time, and you get such a great result, such a great resolution of the inflammation and the bleeding gums, and that is also what causes bad breath. Those bacteria produce stuff that it doesn't smell particularly good, and people notice that when they're talking to you. So when you can effectively remove that, it really enhances not only the health of the patient, but it also makes it a lot more socially enjoyable for them to talk to people, to be close to people. And that is really a benefit to them.
So people with loose teeth, right? You say after the procedure, they're clean, the teeth could get strong again. How's that work? Why is that?
Well, inflammation has this way of working around tissues that is not very desirable. And around teeth, inflammation produces this effect where the tissues just aren't as firm. because firm tissues is what keeps everything in place. That is true not just in the mouth, but in the body overall. As you remove the inflammation around the teeth, you're also tightening up the tissues around the teeth.
So the gums grab onto the tooth? That's why they get stronger?
They do. There is a much tighter cuff around it, and it is very noticeable. And that then is, as a result of that, the patient no longer has bleeding gums also, because that same inflammation causes the teeth to be loose and not as firm. Also has to do with the development of bleeding gums and uncomfortable gums, because it becomes much more unpleasant to take care of your mouth when it's all inflamed.
Okay, you don't like on the bottom of boats. I just want to make sure we're getting this right. You know, they have like the barnacles or whatever that grow underneath there, right? So is it the rough, is it tartar we're talking about?
Exactly.
Underneath the gum line?
Correct.
Is it the rough spots that are irritating the gums, or is it the bacteria that's irritating the gums, or both?
Well, both. It is the living bacteria, but also the byproducts that they leave behind on the rough surfaces. The rough surfaces that are on the roots, they contain chemicals that are very toxic to our tissues. So it's just the living bacteria problem, but also what they leave behind. So that's why you need to tackle both of them. You can't just tackle one and not the other. And that is really the reason why the antimicrobials and the antibiotics and the chemicals that are put between the gum and the tooth, they are tackling the bacteria, but they don't remove all the bacteria. They remove some of them, and they leave behind the chemicals. And as a result, that alone can never really be an effective treatment. It is a temporary fix. The point I really want to make with you is when you do a deep cleaning the standard old-fashioned blind way, what happens is blood is in the way, saliva is in the way, the tongue is in the way. Really, pretty much everything is in the way. So in those circumstances, it is very difficult, really impossible, to visualize a lot below the gum line. I mean, it's just really...
And they do it by feel?
Purely by feel. It's called tactile sensation, but it's just very incomplete. There's only so much you can feel through an instrument that is below the gum line, with the tongue in the way, saliva in the way. You can imagine what that might be like when you're doing this procedure. It's very challenging to be a good hygienist.
All right.
Now, when you do this with a camera, you're actually, everything that's in the way is out of the way. You're having a camera below the gum line. You can inspect the root surface all the way down to the bottom.
So she's not even looking at the area. She's looking at what, a camera?
She's looking...
Is it up above, straight in front of her face?
It is straight in front of her. So it's a little different at first, because instead of bending over and trying to look in your mouth, she's actually looking across your face at a monitor. And the monitor shows the image of what is actually going on below the gum line. That monitor shows the image in color, and that's quite astonishing to see the first time you see it. It's really incredible. And then the magnification is up to 40 sometimes. So that allows her to see every detail on the root that she needs to see. And those details, those roughness, the barnacles underneath the ship, if you will, they are all underneath the gum line. And unless you remove them, you're going to have residual inflammation there.
So your hygienist does this. You do it as well. Does your hygienist tell her hygienist friends, you got to get your doctor to buy one of these Periscopes? Does she? Is she like an advocate for it? Because logically, it seems like, why would you want to get it done any other way?
Oh, she does, but ultimately decisions of buying equipment don't rest with the hygienist typically. It's just not something that is commonly purchased. But there is really no better way and no other way to do that type of deep cleaning and to provide that type of care for patients.
So we haven't even mentioned this now. Your wife works with you too. Does she also do this type of work?
She does not do this type of work. She actually does advanced imaging.
She's a dentist also, right?
She is a dentist. She is an oral and maxillofacial radiologist. And that means that she gets to play with a very fancy and expensive equipment that shows three-dimensional imaging.
Now, a lot of people go to you to save teeth, right? I mean, you're the guy.
Right.
Do you feel like if you want to save your teeth, that you're probably one of the best places to go?
Do
you secretly think that? Go ahead and say it if you think it's true.
Yeah, I believe that's true. You know, it's
because you're using this Periscope to get rid of the gum disease,
right?
Which no other doctor that you know of is doing it out there.
In our area, I don't know if anybody
across the country,
else.
is it less than 2% dentists have this Periscope?
Oh yeah, there's really only a handful in terms of a couple of dozen across the United States. It's a very rare technology. I think it's just a matter of people are unfamiliar with it. There is a long learning curve. You really have to have the right mindset for it, because this is not a quick and dirty procedure. This is a detailed procedure that results in a superior result, but you have to put in the time and effort to do it right.
Everybody would do it. I mean, nobody could I have a periodontist sitting here and saying, it's a bit of an exaggeration?
Well, anybody could learn how to do it if they're willing to put in the time.
So it's just a hassle
and
to learn,
effort.
but it's the best way to go?
Right, absolutely.
When cleaning teeth, it sounds like it.
Absolutely. If I ever needed a deep cleaning, which I have not needed, but if I needed one, that is the only way that I would let somebody touch my teeth.
You say you're transforming people's lives. Mm-hmm. How so?
When patients come in, they have uncomfortable gums, swollen gums, bleeding gums. They may have bad breath. They may have been losing some teeth. They may have gaps in spaces that develop between the teeth. None of those things are very enjoyable to have, and it affects people's lives. They become more withdrawn, and I have seen that in my practice. Patients that were outgoing, were out there, were living life the way it's meant to be lived, they become more withdrawn because they become more self-conscious, and it affects their quality of life every day. The quality of life issue is really why I became a periodontist, because we can affect it so much. So when they come in and they have a treatment such as perioscopy done, and their gums become comfortable, they're no longer bleeding, they don't feel self-conscious about it, they can go back to their spouse or to other people and feel like their breath is not offensive to them. It just transforms their lives.
You said they have shame. Elaborate on that.
Well, a lot of people blame themselves for what happened to their mouth. The way I look at that is, we're all on a path in life, and we go in a certain direction due to a variety of choices and circumstances. Some are in our control, some are not. It's really not up to us as dentists to judge a patient.
So when they come in with bleeding gums, bad breath, teeth are loose, lots of pain, they're just like completely self-conscious? Like even in front of you?
Oh, they are.
They don't want to smile in front of you or show you their mouth?
I have patients that actually are holding their hand in front of their mouth while they're talking to me during the initial consultation. Now that tells me that they are more than self-conscious. Because as a dentist, I have seen lots of that.
So you don't blame them?
Not at all. I mean, our goal is to be there to help them achieve the level of health that they would like to achieve and the quality of life that they would like to have. I had this one patient, and she came in, she was very distressed. She was sort of middle-aged, and she had gone to a periodontist that recommended that all her teeth be removed and that she have some sort of implant-supported prosthesis. And she was devastated because she was mentally not at that point. She did not want to lose her teeth. She was really afraid of losing her teeth, but her gums had become so uncomfortable and so unsightly, she really didn't know what to do. The dentist that she saw referred her to me, and we decided that perioscopy would be a great way to treat her.
And for people just tuning in, perioscopy is a deep cleaning under microscope, cleaning the whole area under the gum line.
Correct.
Okay. So
we did that for the whole mouth. So she had perioscopy around every single tooth in her mouth because every single tooth was really inflamed, had bleeding gums. Every tooth was a problem. So after the perioscopy treatment, it takes about 4 to 6 weeks for the gums to finally be back to normal. I mean, it takes a little while for the tissues to adjust to the new situation. They're in a healthy environment, and they haven't been used to that in a while. So that's a big change. This patient came back, and she couldn't believe it. She was comfortable. Even her husband would come closer to her because her breath was actually enjoyable again. The patient then, it transformed her life so much. It was a joy to watch. And that is really what makes me come into the office every day. You see the transformation in people's lives that is exciting to watch. It really is. It's a privilege, really. So this patient was amazed because she was told that all of her teeth needed to come out, and actually none of her teeth needed to come out.
Is that happening a lot, by the way? It's hard to believe.
So
you see patients that say these teeth have to come out, and when they see you, you save their teeth.
We see that all the time. And I don't know why.
Are they frustrated? I mean, this woman, even though she's happy, is she saying, I can't believe I was told my teeth had to be taken out.
People are frustrated and angry even because they just didn't think that was necessary, and they were right. So they were correct about their own mouth. It's a shame that people lose teeth that they don't need to lose, because at the end of the day, the dental profession should be there to help people stay healthy. And dental implants are a great solution when you need to lose teeth or when you have lost teeth. But if you can keep your own teeth, that is still the optimal treatment.
So are there a lot of teeth that are being pulled in Colorado that don't have to be?
That is definitely my observation, that I have seen that. And it's really a shame. It doesn't need to be that way. I had another patient, Randy, and she was a young professional. She had just started a new job, and she had really overall a healthy mouth. But she had one tooth that was a problem. It was becoming painful. All of a sudden, something was happening. This tooth was losing bone very rapidly. The dentist wasn't sure what was going on with the tooth, so he referred the patient over to my office. He was fully expecting that I would have recommended removing the tooth and replacing it with a dental implant. But I thought, well, maybe not so fast. Why don't we first examine, why is this one tooth having this problem? Is it something that can be treated effectively so that this young lady, who's a professional, doesn't want to lose a tooth at a young age, and certainly doesn't want to take a lot of time off work as well, because she was just starting a new career? Is there some way that we can save that tooth? We went in with perioscopy and we saw what the problem was with the tooth. There was a lot of inflammation and infection in that area, as you would expect to see. We were able to remove the problem that was causing the issue right then and there, and allow the bone to grow back, because that is ultimately what was needed in this particular situation. And I'm not suggesting that happens all the time, but in her situation, that is what happened, and that is what we needed for her to save the tooth.
So when you clean that area, like the body makes a little bit more bone, the gums hug the tooth again,
right,
and it's strong.
It is strong.
Am I understanding it correctly?
That is correct.
Is that a simplified version of that's what's happening?
And that can happen. It depends on the circumstances.
Okay.
But in this particular situation, we were actually able to use the miniature access to this tooth to actually place a bone graft, because there was no need to make incisions, to put sutures in, to put this lady through a whole lot of postoperative discomfort, because this could be done through an opening that was so small you could barely see it with a naked eye. It was amazing. I was really impressed.
So no more bleeding gums, bad breath, loose teeth, and you could avoid extractions a lot.
Exactly.
Would you say every week people that were told your teeth have to be pulled, and you're saying, I don't think so?
That's exactly right.
Does that happen every week in your office?
That happens every day.
You need to go on TV with this message. Because if that's true, that's great. Well, and I'm not trying to side with you, but it sounds good.
Right, no, I mean...
it seems logical.
Right.
You go in and go to the root cause, clean it up.
The root cause, I like that term. Ultimately, the disease is on the roots, below the gum line. And if you can get to it before it's too late, then you can help a lot of people save their teeth and not need to go to further treatment that is more costly, more involved, more time in the chair. And they don't need to do that necessarily.
So this is a less expensive way to save teeth. Is it less than laser treatment?
I would say so. I don't use a laser, but from what I understand, it is a lot less costly than laser treatment. I got to tell you about this one more patient.
Okay.
He was a gentleman in his 40s, and even at that young age, he had let his health slide a little bit. He had diabetes. He was overweight. He was having health problems. He would also have a lot of gum inflammation, and it was affecting his life. He had bleeding gums. They were uncomfortable, they were unsightly, and he had sort of given up on the dentist. He basically had stopped going to the dentist. He had, in other words, given up hope. What ended up happening was he came into my office. We were able to do the perioscopy for him, and it was an amazing result. The inflammation around his teeth resolved completely, and he was able to resume his normal daily activities, and he was no longer self-conscious about them. But the other really cool part for him was he was struggling with his diabetes. There is a connection between the inflammation in the mouth and diabetes, because they're both inflammatory mediated diseases. And what ended up happening with him was he got a better control of his diabetes for the first time in years. His medical doctor had been working with him for years to get the diabetes under control a little bit better, and it just wasn't happening. The inflammation was resolved in his mouth, and shortly thereafter, you could see the improvement in his diabetes situation. At the end of the day, he was happy with where he was. He went out in life again. He was able to meet people. He was able to socialize, which he hadn't done much of. And he was smiling, he was eating, he was doing great.
So we are out of time. But if you have to go in for a deep cleaning or this scaling and root planing, make sure it's being done with a periscope.
Absolutely.
Is that right?
That's
You
absolutely
believe that?
true. Yes.
Okay, and since you're the only guy really doing it, there's not a lot to choose from. You're going to be busy, right?
Yes.
Okay, you have to add on to your reception area.
That's
but
right.
You like this. Well, good for you. And final message to somebody watching this, and they don't want their teeth removed. They've been told their teeth have to be removed. They have all the symptoms you've been talking about. What's your message to them?
If you have bleeding gums, if you have bad breath, if you have teeth that are beginning to loosen, if you develop gaps between your teeth, spaces between your teeth, or if you've been told that you have teeth that need to be removed and replaced with dental implants, that may not be necessary. You really should get a second opinion. You should come and see us about perioscopy and see if that can offer a solution for you. Also, if you've had repeated episodes of deep cleaning and you are still going in for deep cleaning because it is not getting any better, it really isn't improving, then you should come for a second opinion. The other type of patient that should really be considering second opinions is people who go to the hygienist in their office and they're hearing these numbers that the hygienist calls out, and these numbers indicate to what extent you have a periodontal gum problem. And if you hear 5s, 6s, 7s, something should be done. This is a chronic disease that is progressing, and you don't want it to get to a point that you really can't be helped anymore.
But it's easy to take care of, really.
Yes, very much so. And of course, the earlier you take care of it, the better it'll be.
So this cycle of deep cleaning after deep cleaning after deep cleaning happens, what, every 3 months, every 6 months?
Not typically that often, but it happens more often than you'd like it to be. Yeah.
And so you're saying that if you go in with a periscope,
you
can
don't
eliminate that, save money.
Absolutely. You don't need to do that. And then you simply have to go in after that and have routine hygiene maintenance. That is not deep cleaning. It is routine maintenance, and that should be done for every patient.
Okay, good. I want to thank you for coming on the show. Great stuff. And we'll have to have you back on the show because I know you do a lot of other things.
That's
so
right.
Thanks again.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.